The last 48 hours have seen religious leaders working round the clock to save talks aimed at ending a strike that has crippled the public healthcare system for over 2.5 months now. At the moment, leaders from KMPDU and the national and county governments are meeting, and the government is said to have presented a revised offer to the doctors. In the new offer, the government is said to have moved up from the 40% pay increment. The Ministry of Health has also agreed on scholarships, but under new terms, different from what the doctors had presented. Details of this arrangement are still scanty at the moment. Other than remuneration, doctors wanted training opportunities, better working conditions, and employment of at least 1,200 doctors every year to bring down the doctor-to-patient ratio. By early morning, the clergy, led by Catholic Archbishop John Cardinal Njue, had presented President Uhuru Kenyatta with a proposal of what they had agreed with doctors.
Wizara ya Afya haina shida yoyote, wenye shida ni sisi ambao kwamba tumekosa matibabu.
This proposal being the fruit of 48 hours of intense discussions between leaders from the Christian faiths of Catholic and Pentecostal and Muslim religions. The religious groups coming in during a period when negotiating parties were expressing frustration that they were not making any headway. By Friday last week, the KMPDU GOK talks had hit a deadlock. The government had stuck to its 40% pay increment offer given in January by President Uhuru Kenyatta and rejected by the KMPDU. The KNCHR LSK, who are the mediators, had given the parties until end of business Tuesday, the 28th of February, to get back to the talks or be forced to compile the report that is expected to be presented to the Court of Appeal this Thursday. According to our sources, the talks will extend to Thursday morning at 7 a.m. in an effort to reach an agreement before they go back to court at 9 in the morning. Some of the underlying factors leading to the stalemate were complaints by doctors who say they were frustrated and dismayed that the government had refused to improve the offer they had given to the health workers. The government, on its part, had said implementing what the doctors wanted would cost as much as an entire national budget. The doctors' anger being aggravated by the fact that the union had revised their demands downwards on 2 occasions over the last week.
We are willing to compromise. It's time for compromise.
The effective date of the collective bargaining agreement was a major contentious issue to the KMPDU. The government is pushing for July 2017, while the union is stuck on June 2013, the date they signed the agreement. The other bone of contention is remuneration, as the government would have to pay accumulated arrears. Leila Mohammed, NTV.